Thank you. Good afternoon, everyone. Welcome to the Assembly Committee on Health and Human Services. I will call this meeting to order. Madam Secretary, please call the roll.
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black. Here. Assemblywoman Gorlow.
Here.
Assemblyman Hafen. Here. Assemblywoman Krasner. Here. Assemblyman Matthews. Here. Assemblyman Orenlicker. Here. Assemblywoman Peters. Here. Assemblywoman Summers Armstrong. Here. Assemblywoman Thomas. Here. Assemblywoman Titus. Here. Chair Nguyen.
Here, and I believe Assemblywoman Thomas answered here. Everyone is present. Welcome to the audience and welcome to the people that are in person joining us for this meeting. Today we just have a work session, so I am going to get right into it. I see we have one person in the room, so I'm going to start with that bill. So I'm going to take it a little out of order and start with Senate Bill 329. Mr. Ashton, can you please summarize the bill and any amendments?
Thank you, Madam Chair. For the record, Patrick Ashton, Committee Policy Analyst. We heard Senate Bill 329 on May 5th. It requires hospitals and certain physician group practices to notify DHHS of any merger, acquisition, or similar transaction in which they are involved. The department must post the information contained in such notices on the internet and publish an annual report based on the information. Additionally, the bill prohibits healthcare providers, including healthcare facilities, from entering into, offering to enter into, or soliciting a contract that prohibits a third-party insurer from steering covered person to certain healthcare providers, or placing healthcare providers in tiers, or places certain other restrictions on the insurer. Healthcare providers or insurers who violate these provisions are subject to a civil penalty and are guilty of a Category D felony. Finally, the bill authorizes the Attorney General to use certain fees to investigate prohibited contracting practices. Amendments. Senator Lang proposes the following amendments. Please see also the attached mock-up to the work session document. Amendment 1. Revise Section 1 to additionally require a person who owns all or substantially all of a physician group practice to report to DHHS any merger, acquisition, or similar transaction in which he or she is involved. Amendment 2. Revise Section 20.9 to prohibit a provider of health care, including a facility that provides health care, from willfully entering into, willfully offering to enter into, or willfully soliciting a contract that, number 1, prohibits a third-party insurer from steering covered persons to certain providers of health care or placing providers of health care in tiers, or, number 2, that places certain other restrictions on the third-party insurer. Amendment 3, revise sections 20.9 and 20.95 to make a provider of healthcare or third-party insurer who commits certain violations subject to a misdemeanor instead of a felony. Madam Chair.
Thank you. At this time, do we have any questions from members? I have one question here from Vice Chair Peters. Go ahead.
Thank you, Madam Chair. I really want to extend my appreciation to the folks working on this bill to get through some of the concerns that came up during the hearing. I just have one thing I want to clarify on the record. I'm going to ask legal if that's okay, Chair.
Yes, go ahead.
So in a case of contracts, if the contract does not have prohibitive language in it about that would direct how the networks were derived or who is the provider in a network, it would not fall under the provisions of 20.9. Is that correct?
Carly O'Krent, for the record, that's correct. Unless the contract expressly prohibits the third party from contracting with another provider, the contract won't violate the provisions of this bill.
Perfect. Thank you so much.
Do I have any other questions on the bill from committee members? Seeing none, I'd entertain a motion to amend and do pass Senate Bill 329. I have a motion from Vice Chair Peters. Do I have a second? I have a second from Assemblywoman Benitez Thompson. Do we have any comments on the motion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. And if you could raise your hands, Assemblywoman Black, Assemblyman Matthews, Assemblywoman Krasner, Assemblyman Hafen, and Assemblywoman Titus are all no. The motion does carry, and I will sign that floor statement actually to myself. Next, if we can begin the work session on Senate Bill 5. Mr. Ashton, can you please summarize that bill and any amendments?
Thank you, Madam Chair. For the record, Patrick Ashton, Committee Policy Analyst. We heard Senate Bill 5 on May 7th. It makes various changes to telehealth. It clarifies that the definition of telehealth includes both synchronous and asynchronous interactions, and it adds audio-only interaction to the definition of telehealth, except as it relates to industrial insurance. This change effectively revises existing law that requires certain insurers and third-party payers to cover telehealth services to the same extent as if provided in person to also apply to services provided through audio-only interaction. The bill provides for certain prohibitions for third-party payers. In addition, SB 5 requires third-party payers to cover telehealth services in the same amount as services provided in person or by other means, except for services provided through audio-only interaction. Senate Bill 5 expressly authorizes healthcare providers to establish a relationship with patients through telehealth and authorizes the State Board of Health to adopt regulations governing the establishment of a relationship in this manner. Finally, the bill requires DHHS, to the extent money is available, to establish a data dashboard that allows for the analysis of data related to telehealth access. Amendments. Lindsay Knox from McDonald-Carano proposes to amend Section 7 as follows. Remove from subsection 6D of NRS 616C 730 the use of asynchronous system of storing and forwarding information as a form of telehealth delivery, thereby allowing only the use of synchronous audiovisual communication technology for telehealth services relating to industrial insurance. Chair Wynn proposes to revise the payment parity requirements for telehealth services throughout the bill to expire 1 year after the date on which the public health emergency relating to the COVID-19 pandemic expires, but no later than June 30th, 2023. The amendment requires an exception for behavioral health services if the expiration date is before June 30th, 2022. In this case, behavioral health services provided through telehealth will continue to be reimbursed at the same rate as in-person services until June 30th, 2023. Madam Chair.
Thank you, Mr. Ashton. Members of the committee, are there any questions? Seeing no questions, I'll entertain a motion to amend and do pass Senate Bill 5. I have a motion from Vice Chair Peters. Do I have a second? A second from Assemblyman Hafen. Do I have any comments on the motion? Go ahead, Assemblywoman Krasner.
Thank you, Chair Wynn. I appreciate the amendment. However, attorneys always get paid for their audio-only advice. I can't imagine us asking them not to get paid for that, and I just feel that this is bad policy, so I'll be voting no.
Thank you, Assemblywoman Krasner. Do we have any other comments on the motion? Seeing none, all those in favor say aye. Aye. All those opposed, all those opposed say nay. And if you could raise your hand if you're a nay. I have Assemblywoman Benitez Thompson, Assemblywoman Krasner, Assemblyman Matthews, Assemblywoman Black, and the motion does carry, and I will assign that floor statement to Vice Chair Peters. If next we could move, I'm kind of going out of order again, if we could move to Senate Bill 396.
For the record, Patrick Ashton, Committee Policy Analyst. Senate Bill 396, we heard this bill on April 26. It authorizes public agencies in Nevada to enter into agreements with private entities within or outside of the state for the purchase of prescription drugs, pharmaceutical services, or medical supplies and related services. In addition, it authorizes DHHS to enter into such an agreement for the purchase of prescription drugs for Medicaid or CHIP. The bill also exempts from certain transparency, rebate, and audit requirements certain Medicaid or CHIP contracts between DHHS and a pharmacy benefit manager or health maintenance organization entered pursuant to an agreement for the collaborative purchase of prescription drugs. Amendments. Senator Doniate proposes to revise subsection 2C in section 2, page 4, by removing provisions to exempt a contract between DHHS and a pharmacy benefit manager or health maintenance organization entered into pursuant to an agreement for the collaborative purchasing of prescription drugs from certain requirements concerning transparency, rebates, and auditing. The amendment makes conforming changes throughout the bill. See also the attached conceptual amendment, Madam Chair.
Thank you. Do we have any questions from members of the committee? I have a question here from, go ahead, Assemblywoman Benitez Thompson.
Not a question, just so much statement is a thank you to the Senator Doñate because he got a chance to meet with our legislative auditor, Mr. Crossman, and spent some time talking with him. And I'm just appreciative of any time that we can keep our ability to trace and track our dollars in the state. I think it's part of good government. I think it's part of transparency. And it's a lot of money. We want to be able to follow it and audit it. So I'm so appreciative of this.
Thank you for that. Do we have any other questions regarding this? Do I have a motion on this? I have a motion, I believe, from Assemblywoman Benitez Thompson, a second from Assemblywoman Peters. Do we have any other further comments on the motion? Seeing none, all those in favor say aye. Aye. All those opposed say nay. That passes unanimously, and I will assign that floor statement to Assemblywoman Thomas. Next, if we could go to our last bill, Senate Bill 188. Mr. Ashton, can you summarize the bill and the proposed amendments?
Thank you, Madam Chair. For the record, Patrick Ashton, Committee Policy Analyst. We heard Senate Bill 188 on April 26. It provides for the establishment of the Individual Development Account Program by the Office of the State Treasurer if sufficient money is obtained. The program allows certain persons from low-income households to establish an IDA into which a person deposits money to save and use later for certain purposes. The State Treasurer may select one or more fiduciary organizations to administer the money in the program. The bill provides for certain other provisions as outlined on the bill page. And now I'll go straight to the amendments. Senator Spearman proposes the following amendments, and see also the attached mock-up to the work session document. Amendment 1, revise the bill to additionally authorize a relative or fictive kin of a child placed in his or her care by an agency which provides child welfare services to qualify to become an IDA holder, establish an IDA for a child placed in his or her care, and deposit certain money received by him or her into the account. Amendment 2, provide that money deposited in an IDA established by a relative or fictive kin of a child placed in his or her care is the property of the child and may be accessed by the child upon reaching 18 years of age and used for certain other purposes. Amendment 3, require an agency which provides child welfare services to ensure that instruction in financial literacy is provided to a child on whose behalf an IDA is established by a relative or fictive kin to the extent that money is provided by the State Treasurer. Amendment 4, replace individual definitions of fictive kin throughout Chapter 432B with a chapter-wide definition of the term that is identical to the definition of the term currently used in individual sections of that chapter. And last amendment, authorize the State Treasurer in subsection 5 of Section 25 to adopt specific regulations relating to the administration of IDAs by fiduciary organizations, including, without limitation, regulations governing fees charged by fiduciary organizations. Madam Chair.
Thank you. I know that there were a couple of amendments there, and I appreciate the members that reached out to make this bill better. Are there any questions, though, regarding those amendments on Senate Bill 188? Seeing none, I would entertain a motion to amend and do pass Senate Bill 188. I have a motion from Vice Chair Peters, a second from Assemblywoman Titus. Do we have any comments on the motion? Go ahead.
Thank you, Chair. While I certainly believe that the intent of this bill is good and even admirable, my belief is also that this is just not something that belongs within the purview of state government. So I'm going to be a no on this today. Thank you.
Go ahead, Assemblywoman Black.
I just wanted to second my colleagues' comments and just say that I feel like this is a better job for a nonprofit or something of that nature.
Any other comments on the motion? Seeing none, all those in favor say aye. Aye.
Aye.
All those opposed say nay. And I have a nay from Assemblyman Matthews and Assemblywoman Black. And with that, the motion passes, and I will assign that floor statement to Assemblywoman Summers Armstrong. And with that, you're welcome. With that, we are done with our work session. Almost done. At this time, I will begin public comment. Broadcast services, if we can go to the line, I just remind callers to please clearly state your name and spell your name for the record. Please limit your comments to 2 minutes, and we can begin when you are ready.
Participate in public comment, please press *9 now to take your place in the queue. Chair, the public line is open and working, but nobody wishes to participate at this time.
Thank you, Broadcast Services. So at this time, I will close public comment. Are there any comments from members before we adjourn today? Oh. Okay. It does conclude our meeting for right now. So we will be taking a recess. Please, if we do later adjourn, I will let attaches know, and we will be able to do that in a public way. But we don't, just to give you a lay of the land for next week, I don't have a meeting scheduled for Monday. But I anticipate we will still have some things that are coming out next week, so we will probably have other meetings, but we do not have anything scheduled for Monday afternoon. With that, we will stand at recess.